YouTube video got 7 million views in 7 months, and it's talking about getting hair transplants in Turkey because they're so much cheaper than getting them in the US. If you're thinking about a hair transplant, but before you book your trip to Turkey or Mexico for a cheap fix, please watch this video. My name is Dr. Swati Kannan, and I am a hair transplant surgeon out here in California, and I see way too many patients who come in for corrective procedures because they regret the transplant that they did abroad. In today's video, I will break down what makes a hair transplant natural and long-lasting, and why some options overseas can leave you with more problems than the hair on your head. So make sure you watch this video till the end, and you'll learn why this result is not a good one. When it comes to hair transplants, there's two main techniques: FUE, which stands for follicular unit extraction, and LSE, which stands for linear strip excision. FUE is a newer method of doing hair transplants where we remove individual follicular units from the back or the side of your head and then transplant them to the recipient site, which is where the hair loss is predominant. The pros of doing FUE is usually you get minimal to no scarring. Because we're removing such little areas from the donor site, these areas tend to heal pretty nicely without leaving a noticeable scar. It's also a much quicker recovery, and it's better in younger patients who tend to be more athletic and want to exercise, so they do want a quicker recovery. Younger patients also have a tighter scalp, and so if we do a linear strip excision in those patients, you're just going to have a more visible scar at the back of your head, which is the telltale sign of a hair transplant. So for younger patients, especially men, I prefer FUE over the linear strip excision. The maximum number of hair transplants we can do with FUE is about 5,000. So whenever patients go to Turkey and they get like 4,500 units transplanted, that's a lot of hair transplants that most patients don't really need. So if you're young, you really need to think ahead and preserve those donor sites in case you need a second hair transplant down the road. LSE, like I said before, stands for linear strip excision, and this is where we cut out basically a strip of skin containing hair follicles from the back of your head. That donor area gets stitched up, so you usually get this linear scar, which is, a lot of patients, that's how you know somebody's gotten a hair transplant. But you get this linear scar, and then the text will separate out the hair follicular units, and you'll have 1, 2, or 3 follicular units. Those are then transplanted onto the recipient site. The pros of doing LSE is that you get way more grafts than you can with FUE. From LSE, you can get about 5,000 to 8,000 grafts, depending on the person, to be able to transplant. It's better for larger areas of baldness. It's also something that's better to do in an older patient than a younger patient, because older patients tend to have more lax skin, therefore that scar may not be as visible. LSE is also a decent option for women because of the fact that we usually have to shave to be able to do FUE. So instead, if we just take out a strip, yes, you will have a scar, but usually your long hair will hide it. However, I still tend to do FUE for women for the most part, just because the recovery is much faster. In some patients, we can actually combine FUE and LSE to maximize donor grafts. In order to understand hair transplant, we first need to understand the scales for determining the type of alopecia or the severity of alopecia that you have. Alopecia is another term for hair loss, and the most common form of alopecia is androgenetic alopecia, which is usually the reason why men want hair transplants. We use something called the Norwood scale to classify the stages of male pattern baldness. Stage 1 and 2 is usually very mild hair loss. Typically, I don't like to do a hair transplant for stage 1 and 2. Typically, we can handle these in other ways. Additionally, if you are at Norwood scale 1 or 2, you're usually on the younger side and your hair loss pattern hasn't been fully developed, so I don't really recommend doing a hair transplant under the age of 25 for this very reason. In younger patients, if we tend to jump the gun and do hair transplants really early on, then we're going to lose that precious donor hair graft sites, and you're going to have a patchy look as you get older. And the reason is your transplanted hair does not respond to hormones like your normal hair. So your normal hair is susceptible to further hair loss due to the influence of androgenic hormones. However, the transplanted hair is not. So if we have a chia pet of hair transplants in the front of your scalp, but the rest of your hair starts receding as you get older, that's going to look incredibly weird. This is why I don't really transplant in younger patients under 25, or if you have a Norwood scale of 1 or 2. The ideal time to consider a hair transplant is when you're at the Norwood scale of 3 to 5. This is when you have developed a clear pattern of hair loss, but you also have enough donor sites for us to be able to perform a hair transplant. At stages 5 and 6, while we can achieve pretty good results, you're not going to have a thick hair density just because we would need a lot more grafts to be able to give you thick hair density. So the results are good, but the density won't be as full as when we do hair transplants at Norwood scales 3 and 4. And at stage 7, which is complete baldness pretty much, and we can still do transplants, but we're mainly going to use the hair transplants to be able to frame your hairline and your face, and we're not going to be focusing on creating density. Let's say you are somebody who is, in their late 20s and you're considering a hair transplant. Should you get a lot of grafts or should you be a little cautious? I tell my younger patients, I know it's really, really tempting to get as many transplants as possibly can when you're younger to have that dense look. However, that is just not going to age well. If we use too many grafts early on, we're not going to have enough for down the road in case you need a second hair transplant. Remember, you have a limited number of donor grafts, about 5,000 max if we're doing FUE and about 8,000 max if we're doing LSE. But once these donor sites are gone, they're kind of gone. You can't really get them back. So I recommend a more conservative approach for my younger patients where, their hairline may not be as low as they want. I build the hairline a little bit higher and do fewer transplants, usually less than 3,000 in most patients. In my practice, I actually use a device called SmartGraft, which is based off of follicular unit extraction. Basically what this device does is it kind of just stores and chills the grafts as we're taking them out. So it does take about 2 hours to take out the hair grafts from the donor area. And so as they're being taken out, they do need to hang out in a solution and be chilled, and this device just allows us to be able to extract and store at the same time. We also have a hair tech who will help separate out the follicular units. When we get the donor grafts, we have to separate them into 1 follicular unit, 2 follicular unit, or 3 follicular units. And the reason we do this is because we're going to use different units to be able to recreate the hairline and to be able to build density. Then on the recipient area, we're going to place little slits. These slits are going to be oriented in the direction of this is actually the most important step, because if your slit is like this, then your hair is going to grow straight out, versus if your slit that we create is like, it faces interiorly, then your hair is going to grow out this way, which is what we want. So it's really important how we create these slits so that your hair grows very naturally. And once the slits are created, we then just put the hair transplant plugs in to those slits using forceps. So there is a lot of science and art that goes into hair transplants, and it's not as easy as just saying, hey, I'm going to get 3,500 transplants for $2,000. So you really, again, you want to do your homework. You want to make sure you go to the right person. In the US, hair transplants can range from $12,000 to $20,000, and sometimes in New York, I think it can go all the way up to like $40,000. So yes, I know it's pricey. Whereas in Turkey or Mexico, you can get hair transplants for $2,000 to $5,000. I'm not saying that all Turkish hair transplant doctors are bad. I'm sure there's actually some really great ones, but because the procedure is so cheap, it incentivizes a lot more people to do these procedures without much regulation, and that's where the problem is. So let's review this hair transplant in Turkey. This is what we started off with in this video. Can you tell me what the problem is? Why does it look so weird? Comment below and let me know. So this hair transplant result at first glance are like, wow, look at that hair density. He looks so much younger. But then as you inspect closer, you will find a lot of problems with this hair transplant and why it looks so unnatural. The first issue is the hairline design. So it is a straight hairline, right? So they just went boop, kind of like that bowl cut boys used to have when they were younger. And so this straight hairline, which is low on the forehead, this is not very typical of men. A natural hairline has more subtle, more irregularities that follows the natural contour of the scalp. So when the hairline is too straight, it's going to look unnatural. The second issue is the density and the distribution. So as I said, we're going to have to design the hair transplant so that it just doesn't look like a chia pet on the entire top of your head. We design it so that some areas are more dense than others, making it look more natural. In this particular case, the density is very much the same throughout the scalp, and that again is not normal, it's not natural. Also, like we mentioned before, this lacks a frontotemporal recession, so it's a straight line, versus usually in the temples we should be receding in men, and then it kind of follows this natural contour. None of those points were actually addressed in this particular hair transplant. I hope this video gave you an understanding of who's an ideal candidate for hair transplant, what a natural hair transplant looks like, and what to look out for when you're looking for your transplant surgeon. While a hair transplant is a really great option for many patients, not all patients need to jump to that in the beginning of their hair loss journey. So if you do have hair loss and you want to learn to control it in other ways, please watch these 2 videos next, where I review treatments for hair loss, things that you can do at home, and things that I do in my office. So thank you so much for watching this video, and I will see you in the next one.